Is This Normal, Doc? A podcast sponsored by Tanner Clinic. We are back with part 2 of our mini-series on vaginal health and menstrual cycles. If you missed our last episode, we did an in-depth discussion on vaginal health, pH, yeast infections, bacterial infections. We learned a lot. It was really interesting. And this is part 2. So we're going to be talking about what's normal and what's not with our menstrual cycles. We're back with all the same people. So I'm Hope. My co-host is Chelsea, and we have Dr. Jalee John on with us. So let's get started.
All right. What is considered a normal cycle length, and how much can that vary? And is it normal for it to vary for each person? Or for every person, should it kind of be like everyone's is kind of standard to them, or can it vary within that person?
So one of the biggest things when we kind of talk about cycles in general, I love the apps that are available nowadays. They make it so easy. You don't need to pay for one. Just get a cheap one. They all do the exact same thing. And they give you like so much data, because there's a lot of times people come in and they're like, oh, I'm having a period every 2 weeks. And then we pull it up and it's like, oh, like, no, you're in the normal cycle. So the normal cycle is anywhere between 21 and 35 days, and that's first day to first day. So you can have a period for a week, off for 2 weeks, and a period for a week. That can be normal. And then the flow in general can switch a little bit between 3 and 7 days. So most people will have a consistent of a few days spread for when they're expected to start. Once you start kind of crossing that threshold of 45 days, 60 days, that's abnormal, and we should come in and talk about it and see what's going on.
I just have to say I have a fun little period app. It tells you like what kind of witch you are. It's very fun.
I have not seen that.
And she tells us.
Really want to see
I tell them all the time. I'm like, I'm a white witch now.
Yeah.
And it's like based off the moon. Yeah. But it's so fun. And it's like your hormones are making you really hungry today. Or like, you should be very tired, or are you feeling very energetic today? And it'll like give me a little message like on my phone, and I'm like, I am.
Yeah, whatever makes
it knows me
fun.
so well.
I love it.
And like I sync up with my sister-in-law, so we know. Yeah, it's very fun.
The witches together.
We're witches.
Yeah, but I feel like almost like once a week you'll be like, oh, now I'm a red blood moon witch, and I'm like, what is happening?
I don't know what that means, but it's fun. Yeah, it's fun that I get a little name for my cycle.
They didn't teach me that in medical school, but I'm sure
you're like, you don't know what a red moon witch is. How dare you? Another thing that I think women have a lot of concerns about is how much they're bleeding during their period. So is there ever a time when there's too much bleeding, and when should someone be concerned about bleeding?
So definitely if you get to the point where you're feeling like lightheaded, dizzy during your period, not normal. We should check your hemoglobin, see. Women's bodies in general are really resilient, and we can lose a lot of blood. But there is a point where the bleeding definitely gets too much. Based off kind of like pads, tampons in general, if you're filling a pad or a tampon in an hour, that's too heavy, and we definitely need to look into it and make sure you're not losing too much blood and having anemia, hemoglobin issues, things from there.
Lightheaded, you said?
Lightheaded, dizzy, feel like you're going to pass out.
Filling a pad within an hour.
Filling a pad within an hour. Those are all reasons to get checked out.
During your period, is it normal to have clotting? Is there such thing as too much clotting that you should become concerned about?
Mm-hmm. So smaller clots can be normal, kind of like quarter size, things like that, are just normal flow. If they get bigger than that, then we do want to look into it to try to figure out, like, is there a reason why you're clotting so much? Are the rest of your periods heavy? Do you have polyps or fibroids? Or something in the uterus that isn't allowing the blood to flow normally.
So if someone is bleeding a lot, they're experiencing large clots, or, it's getting to the point where it's detrimental to their health, what are some things that you can do for those women?
We want to kind of take the step back first and figure out why you're bleeding, because that will really change the treatment. Are there polyps there? Are there fibroids there? Do we need to do a hysterectomy if the patient's a little bit older? Things like that. And so in general, we typically, if it's a young, uncomplicated, just hormonal shift that's causing that heavy periods, Anti-inflammatories can always be a little bit of an option. Kind of doing a high dose before the period can help lighten it. Doing, of course, the whole spread of the hormonal contraceptions, birth control, IUD, you name it. Can help tinker with the period. And then there's some minor surgical options, as long as everything else is looking normal, like an endometrial ablation, same-day surgery, super straightforward. And then ultimately, like hysterectomy, taking it out will also stop the bleeding, but we really try to save that for last resort and try the other things first.
For someone who is experiencing like painful periods, irregular periods, when should they reach out to an OB to discuss that? Because I feel like we all have cramps. Like, it's hard to know what's normal and what's not, and what the pain you're experiencing, if that's normal. It's like, I've almost passed out from pain, but it's not every time, so it's hard to know when to go in.
Yeah, so I do recommend just in general that every female should be seeing a gynecologist, and then hopefully at your general like annual visits, we're talking about your menstrual cycle and kind of getting those flags ahead of time. But if you've never seen a gynecologist, come on in and we'll talk about it. But also if it's just in between your visits and if something changes. Usually you can have one cycle that's kind of wonky, life stresses, infections, illnesses, things like that can always throw it off. But if it's more than one cycle, come in, let's chat about it. There can always be different things like endometriosis, PCOS, lots of different hormonal changes that we should look into. And especially, cancer can be out there too. And so we kind of do that big global look and try to pinpoint why are things different.
Yeah. What about irregular periods? Is there anything that should be concerning as far as like an irregular period goes that we should know to come and be seen for?
Yeah, if your cycles are consistently greater than 45 days apart, that look greater than 35 really, then we should look into it. Sometimes we have reasons for it. If you're on like birth control and having weird cycles, then likely it's hormonal related, but it can be just kind of your general endocrine system not talking well. Thyroid issues can make things really wonky too. Yeah. And then, sometimes we'll do birth control depending on just like what your desire is to have a period and control it. And sometimes it's enough to say, okay, well, we know you have PCOS and we know it's going to be irregular. So these are some things that we can tinker with, but we're okay with you having irregular periods versus someone that's never had that diagnosis. And then all of a sudden things are really wonky, then we want to get it checked out.
Can birth control change what is considered a normal period?
Definitely. It depends on what type of birth control you're on. Some of them are specifically designed, like the IUDs, to have lighter periods or to stop your period altogether. The copper IUD specifically will actually make periods heavier, and that can be totally normal as well. And then you can kind of customize with the combined estrogen progesterone, like the pills, the patch, the vaginal ring, to either have a period every month, or to totally skip periods too.
When I was on birth control, I was on the pill and I would skip mine a lot. Mm-hmm. And everyone in the office would be like, you never have a period. I'm like, yeah, it's great. You should try it.
Yep. It's safe as long as we're controlling it and we know why you don't have a period. I mean, it is so safe overall not to have a period. It gets to that unsafe point when we don't know why. We want to make sure we're not missing anything more dangerous.
I'm so jealous of her.
Well, now I'm pregnant, so I'm chilling again.
I know, we're always like, I have cramps. She's like, can't relate.
If I was never...
You also have your own...
Yeah, I was going to say other cramps.
Like, trying to downplay...
No, but I've never had, like, a long period, like 5 days, not heavy cramps, not heavy bleeding. Like, I've always been, like, the easy period girl, and so I always feel bad for people that have like really horrible ones. I'm like, sorry, I can't relate.
And periods can also change after pregnancy.
That's also what I've heard.
After you have a baby, your uterus goes through a lot, and so it's going to be a whole different uterus post baby than before baby.
Maybe I'll join you, Hope, on your blood moon witch.
We can sync up. It'll be great. We can both be witches together. Can lifestyle or other factors make someone skip a period?
Yeah, they definitely can. Like I talked about in the beginning, your period is essentially like trying to get pregnant. And so if it's not a good time to get pregnant, then your period gets real wonky. So if you're really sick, if there's been a lot of stress, even just like that constant cortisol level, weight changes, they're all just kind of signs to your body overall that like, hey, this is not a good time to get pregnant. And then your period can either skip or on the other end get more shorter, breakthrough bleeding, just kind of freak out because your hormones aren't talking to each other very well and your body doesn't know what to do.
So I have lupus. Does that, like autoimmune diseases or like other illnesses, can those affect your period?
Yeah, definitely, which is one of the reasons that I kind of mentioned thyroid before is the most common kind of autoimmune, a little bit more common at least than lupus and things like that. But essentially your body's just in such an inflamed state that it can make it harder to get pregnant or change your cycles. Not always, it depends, on the control, but if you're in a bad flare, then it definitely can make it harder.
How do hormones affect things like mood swings, bloating, acne, all during your cycle?
Yeah, so in the beginning of your cycle, they're a little bit more mellow. Usually people after they're finished their period are feeling decently okay. And then around the time of ovulation, you can have a lot more energy and typically will sleep a little bit better. That's the concept of like, oh, you're more attractive and you're going to go out there and get a guy and get pregnant. And so you get kind of that peak energy. And then after you ovulate, your body's like, ooh, maybe we're pregnant. So we're going to start kind of doing lower energy, kind of focusing all of our blood flow and increasing sleep and getting us more food because we might have a little baby in there that we're trying to grow. And so that is all part of the kind of pregnancy process for your natural body, and that your hormones will mimic that and kind of give you those symptoms.
That's why you need to get one of those apps that sends you little messages every day that's like, do you feel tired today? I'm like, yeah, actually I do. Thank you for telling me. So I didn't even know what this was before I was like researching for this episode, but can you explain to us the difference between PMS and PMDD and like what that is? Because I did not know what it was.
So they're very similar. PMS is, the normal term that people will use before your period. When you're being a special sort of witch, then you'd be like, oh, well, I'm PMSing. And so the PMS is just the normal changes that people can experience. It's the premenstrual syndrome, so changes before your period. And then the PMDD is the official like medical diagnosis of the same symptoms, kind of the irritability, fatigue, breast tenderness, that's actually like impacting your daily function. So similar kind of to the anxiety, depression diagnoses, and they make it hard to work, start impacting your relationships. When that witch becomes a little bit too extra, then that's PMDD.
I mean, I've had those days for sure. Like I'll like cry at nothing and I'm like, well...
And that's okay if you're home by yourself and just chilling. But if you're doing it at work on the podcast, then maybe we should talk about it.
I know. If you guys sense I'm getting a little moody, maybe just put in the comments. Like maybe you need to go see an OB.
Just wait until you're pregnant. Like literally, my husband said something to me the other day, and I just started bawling. And I was like, "Did you want me to cry?" And he's like, "No." And I'm like, "Well, I am. So I blame you." I'm like, okay, I'm just gonna go outside with the dogs. I'm like, that's probably good. I'm like, I need space.
He's like, I can't win in this situation.
Smart man.
Yeah, I'm like, yeah, that's good. Go outside, buddy. Okay, what shifts can women expect between perimenopause and menopause?
It's very variable. Some women can get heavier periods. Some women will get lighter periods. Usually, in general, they're kind of start spacing out as you get older, and then hopefully one day just disappear if you're one of those lucky ones. But for some people, you'll get those classic kind of hot flashes, night sweat, hair thinning, skin dryness, which is so hard because we live in the desert of Utah. And so those can happen kind of 40s, late 40s. The official diagnosis of menopause is kind of 12 months with no period. So we do always recommend, same thing, tracking. So then when you actually get there, because it does make a huge difference on the back end if you have bleeding afterwards. Like, were we menopausal or were we not? What were our periods doing? And so that will be really kind of customizable for each person. But some changes are very normal.
How long is that like phase? Can it be? I mean, I know it's different for everyone, but like what's like a normal time range for like perimenopause?
Yeah, so 5 years of symptoms are kind of the average. It's generally 2 years where people are like, this is real rough, and then it should get better after that.
Okay, so obviously we could just go on and on talking about periods and all of the different things that can affect them, and there's just so many topics that we could cover, but unfortunately we gotta let people continue to live their lives. So I would recommend, if you have any more questions or any concerns, to make an appointment. Dr. Jalee John is a great OB. We were so happy to have her on here today. Thank you so much. Make an appointment with her and she would be happy to see you.
Absolutely.
Yeah, and she's great. I have enjoyed talking with her and learning so much from her today.
And you'll come make an appointment?
Yeah. I was also going to plug your social media because Dr. Jalee John on social media, we just like discovered how awesome it was and how fun your guys'
She has great MAs too.
Yeah, her and her MAs are making the best content out there.
Always.
It's very informative as well. So she's cool. She's smart. You should definitely make an appointment with her. But thanks again for coming on.
Thank you, guys. I had a blast.
Yeah.
Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.